Hi guys, today I will be sharing with you guys about how to read foot radiograph, more specifically about foot radiographic anatomy, approach to reading the foot radiograph, and also the common pathology seen in foot radiograph. So the common projection done for foot radiograph is anterior posterior and oblique view. This is a foot radiograph of an adult patient in anterior posterior or AP view. So a few radiographic anatomy of the foot that you should know. So the ones that I have coloured are the foot phalanges. So the purple coloured ones represent the proximal phalanges. The blue coloured ones represents the middle phalanges. And the yellow coloured ones represent the distal phalanges. So the yellow colour represents the metatarsal bones. This is the first metatarsal bone, and then this is the second, third, fourth, and fifth metatarsal. So the yellow colour here represents the cuneiform bone. The most medial is called the middle cuneiform, and then the middle one is called the intermediate cuneiform, and the most lateral is called the lateral cuneiform. And the green colour represents the navicular bone. So the yellow colour here represents the cuboid bone, and then the ones outlined in red here is the talus bone, and then outlined in orange here is the calcaneum, and then outlined in green is distal tibia, and also here is distal fibula. For the approach to reading foot radiograph, first of all, look at the outline of the bone cortex. It should be smooth. Look for any cortical break or radiolucency to suggest fracture. Secondly, look at the Lisfranc joints. So the base of the second metatarsal is held in mortise created by 3 cuneiform bones. This helps to prevent lateral slip of the bases of metatarsals during weight bearing. So on AP view, the medial margin of the base of second metatarsal should align with the medial margin of the intermediate cuneiform bone. On oblique view, the medial margin of the third metatarsal should align with the medial margin of the lateral cuneiform. Lastly, look at the hindfoot bone, which is the talus and also the calcaneum. And also don't forget to look at the hindfoot midfoot articulation. So now we have a look at the common pathology seen on foot radiographs. So first of all is phalangeal fracture. So in this radiograph, you can see that there is a fracture of the proximal phalanx of little toe here. So next is metatarsal fracture. So in this radiograph, you can see that there is a fracture of the shaft of the third and fourth metatarsal bone. This one and this one. So next is base of fifth metatarsal fracture here. So it represents an avulsion injury from contraction of peroneus brevis muscle and the pull of plantar aponeurosis. So next is Jones fracture, this one. So this is a transverse fracture that lies distal to the articulation between the bases of the fourth and fifth metatarsals. So this is not an avulsion injury, and it occurs as acute injury or following repeated stress affecting this metatarsal. And next is the stress fracture, and this is most frequently missed. So in this radiograph, we can see that at the fourth metatarsal bone, there is a subtle radiolucent transverse line here, and also associated periosteo reaction. So next is Lisfranc fracture dislocation. So from this radiograph, we can see that the medial margin of the base of second metatarsal bone does not align with the medial margin of the intermediate cuneiform bone. So in this radiograph, we can see that there is fracture at the base of second metatarsal and lateral slippage of metatarsal bases. Okay, so that is all for today. I hope you all have learned something from this video. I also hope that it will help you be more confident in reading foot radiograph and improve your patient's care and management. So if you like my video, hit the like and subscribe button for more videos. Have a nice day and I will see you in my next videos.